So the most common cause of poor eyesight in children is undetected refractive errors, that is the spectacles problem. And children can sometimes also be born with congenital problems of cornea, retina, lenticular problems like cataract. Sometimes a child can have a squinting eye, and the eye which squints out can also have weak eyesight. But most commonly what we see in children, the reason of poor eyesight is refractive error or the undetected spectacle powers. So if a child has poor eyesight, by and large children don't complain of seeing badly because they just manage with whatever they are seeing. So it's important for the parents or the teacher to watch out for the symptoms, like if a child is rubbing his eyes very frequently or blinking too often. Suppose he's going closer to the screens to watch television, laptop, holding his reading material close to the eyes. These are ways by which we can detect that the child can be having a problem. Sometimes the child's eye starts squinting. So when the eye deviates outside, that particular eye will have poor vision. It's very important for children to get routine checkup. Let's start by, right from birth. If a child is a premature child, then it's very important for the child to undergo a retina examination to rule out something called as retinopathy of prematurity. Then in their infancy, if the pediatrician detects, any kind of squint or any kind of constant watering in the eyes, they refer the child to an ophthalmologist for an eye checkup, and we have our means and ways to detect how a child can be seen at 1 year of age. After that, from 1 year till 3 years of age, if a child is routinely doing his normal activities and you don't suspect any problem, it's mandatory at preschool age. So between 3 to 4, the first eye checkup is mandatory with an eye surgeon. If the child can read, we show them alphabets. If they don't, we do the symbols. Then we have our own ways to check how, what the eyesight is. But I would say that, and especially if there is a family history of glasses or the parents are wearing spectacles, between 3 to 4 years is when an eye checkup is mandatory. So this is a very commonly asked question that, what can we do so that our child doesn't get glasses? And there's a lot of emphasis on diet and carrot and some kind of exercises, but sadly they are all myths. You have to understand that the glasses power is related to the curvature and length of the eyeball. So we don't have any control on that. Every child has their own chromosome genetic mapping which decides what their corneal curvature, what their eyeball length is going to be, like the way your height and other body organs and skin color is mapped. So with that pre-existing mapping, there is nothing preventive. If a child has to get glasses power eventually, they will, and the progression also depends on the same length and curvature of the eyeball. So diet and exercise doesn't help. Regular checkups so that you can detect the glasses power in time. Do the prevention part of putting the child on spectacles in time, which will prevent further progression. And yes, few things now in the urban population which you need to be careful about is excessive screen time. Though again, screen is not the only factor for myopia or spectacle power, but if a child accommodates more, the literature says that it can attribute to the progression of myopia. So limiting the screen time, emphasizing a lot of outdoor activities, encourage them to be in sun, to play, to have sports, that helps. So regular eye checkups, decreasing screen time, and more exposure to outside activities. So from the time the spectacles are detected for a child till 16, 17, they keep coming for a regular eye checkup and spectacles, and at an age where they can tolerate and wear contact lenses and take care of them, we can put them on contact lenses, say 14, 15 plus. Now, to completely get rid of glasses, the ideal age is 18 or 19 plus, because by that time we assume that the numbers have become stable. There is a pre-LASIK checkup because not every cornea or every eye is going to be fit for LASIK. So there's an exhaustive pre-LASIK checkup, and once we decide that yes, the child's eyes are fit for laser, then these laser refractive options are recommended only after the age of 18-19, when the numbers have been stable and secondly their eyes are fit for LASIK. Once all that has been taken care of, it's a wonderful procedure. The results are very good and they work pretty well. So squint is a problem when there is a deviation of one or either eye, either inwards or outwards. Basically the eyes are not aligned. So the squint can happen either because of spectacle power. So suppose a child is myopia or hypermetropia, a high power, then also they can develop squints, or it could be a muscle weakness, that the muscles which move our eyes inside outside, they are not aligned well, and that's how they develop squint. Yes, there is a treatment for squint, and as I said, that the main two reasons are spectacle power and the muscles being weak. So if it is spectacle powers, then the treatment becomes spectacles, especially accommodative esotropias, eyes which go inside because of poor accommodation and plus numbers. The simple treatment is to figure out what maximum refractive error they have. We give spectacles and the eyes become aligned. So that's also a treatment for their binocular vision to develop properly. So the spectacles become a part of the squint in this type of the squint. Then there is another criteria of squints which is dependent on the muscles not being well aligned. So that has to be surgically treated, where we weaken or strengthen parallel muscles and get the eyes aligned. Not only just for cosmetic purpose, but it's very important for a child to have their eyes aligned because of the binocularity. We have two eyes so that we get better stereopsis, the depth perception, and better clarity. So for that the eyes have to be then surgically aligned. So that's a very interesting and a pertinent question, and a very practical problem also. Many a times once the spectacle is detected in a child, there is a fear, there is a negativity towards wearing glasses, and the parents are perplexed. How do I tell my child to wear glasses if he is resisting it? So first and foremost, you have to remember that the doctor has to break the news in a very positive way. The parent has to take the news in a very positive way, because if the parents face drops and they are disappointed and they are having a negative discussion around it, the child absorbs that and he becomes resistant to wearing glasses. So it should be a very positive environment in which we prescribe glasses to them. Make it a fun activity for a child. If it's a girl, you can ask her to choose a Barbie frame, a pink frame. If it's a boy, there are these fancy glasses, Spider-Man, superheroes. So make them the stakeholders, take them to the shop, make it a good family experience. They can choose their own frame. It could be fun. You could do a reward activity, that if you wear glasses, this is going to be a reward. Show them their superheroes or anybody they like who are wearing glasses. I wear glasses and I tell children that look, they're not looking bad. So the whole environment has to be positive around them, and parents have a huge role to play in that, because the atmosphere has to be conducive for them to wear glasses, because it's a part of their treatment and it matters a lot for their eye. So it's a combined effort.